Emeka and Nkechi, come closer.
Of course, once you hear this, you just know that Aproko Doctor is coming for you. Man, seeing him alone reminds you that you have not drank water today.
He said 5 bottles of water. Big size. One for the DJ, one for the hype man. One for the staff. 2 for my table. You don't get health insurance, you dey drink nonsense. Who you want to impress? Hello? The skin no food, no cool body.
On the episode of this show, we have Dr. Chinonso Egemba, the doctor who loves to tell stories. We talk about his entrepreneurial journey and how he's championing health education in Africa and the rest of the world. Sit back and relax because we're about to have a jolly good time. And while at it, don't forget to hit that subscribe button. Now, let's get to the show. Hello, everybody, and once again, welcome to the Entrepreneurs Connect Show. Now, the Entrepreneurs Connect Show is a show where we interview entrepreneurs from different sectors, and basically we get to ask them questions around life, business, their successes, their failures, and everything in between. Now, today we have a very special guest in the house. You people know him as Aproko Doctor. Well, his real name is, actually let him say his real name by himself. So, welcome, Doctor. Now, it took a lot to get you here anyway, but and I can see why. Welcome to the show. What's your real name? You want to introduce yourself, by the way?
My name is Chinonso Egemba. My manager will be angry with me if I don't put doctor in front, so Dr. Chinonso Egemba. I'm a medical doctor, licensed to practice in Nigeria. I am a storyteller. That's how I like to describe myself. So if in one sentence, I'm a doctor who tells stories.
Interesting, beautiful. Good to meet you. The first time I met you was in 2020. I'll come back to that. I saw the pictures. I saw the pictures some days ago. I was looking so slim.
4 years.
Yes, it's been 4 years. Though. So the interesting thing is that we are going to do something together like since 2020. This is like 4 years later. I finally get to the thing. Well, I'm grateful for the opportunity, by the way. So, the first question I'd like to ask you is where the name Aproko Doctor comes from.
I think it was more serendipity, right? People think there was some sort of brainstorming session that happened before Aproko Doctor. Nah. So we wanted something that would catch the attention of Nigerians simply because we wanted to educate Nigerians in an unconventional manner. The average doctor does not have Aproko in front of his name. The average doctor is prim, proper, it's well put together, well spoken, and then you now have a doctor who is basically doing a member. Doesn't match, and I wanted it to have that shock value, and Aproko just stuck.
Interesting. Who suggested it? You, somebody from the team?
I can't remember, honestly. But I think it was at the point where I was alone, so I think it was me.
Yeah, like, this is interesting. I quite stuck with everybody. If you tell anybody Aproko Doctor, then they know the person is.
It's Aproko Doctor. You don't find Aproko Doctor in the same place.
So, what was life like growing up for you?
I'd say roller coaster, right? I remember a point in my life where we used to go to church in a different car every Sunday because my father sold cars. I also remember another point of abject poverty where we didn't have anything. So it was more like a roller coaster.
How did you adjust?
I don't think it's a question of how did I adjust. It's somehow you just adjust. I mean, you're young and you're malleable, so you've come to understand that abundance is not really there at this time. So even your wants and your needs reduce at some point because you've seen the capability of your parents to provide what you wanted. This was at a time when I think the lowest I can remember was when my mom sold pure water and soda to people who were eating in nearby restaurants. So, and I was the one going to serve them and give them.
Like a waiter?
Yeah, kind of, yeah.
Well, you were serving?
Yeah, so it was serving water and soda. The irony, right?
Interesting. So growing up, did you always want to be a doctor, or were there phases where you wanted to be different things? So at some point growing up, I went to stay with my uncle in Ebonyi State. So he was a pharmacist, he owned this pharmacy. So I was kind of learning in like 2 months I stayed with him. So I was able to dress wounds, I was able to do stuff. So I now had this dream of becoming a doctor. Then I came back, I was now in JS3 or so, and then I wanted to be I want to do political science in school. And then I was in SS2, I wanted to do civil engineering, which I finally did in high school.
Did I have any phases? Yes. At some point, I wanted to be a musician. At another point, I wanted to be an actor. The medicine for me was more like life leading me in that direction. Because my dad had this book growing up, Where There Is No Doctor. And I read that book from cover to cover because I loved books. I just loved words, right? And I was doing well in school. Did well, science class. After science class, what next? I knew I hated math. So engineering was out of it for me. I was never going to do further maths because it wasn't going to work. Irony. Yeah, so it was, since you're smart, why not just become a medical doctor? Because at the time when I was growing up, you were either one of three things. You're either a medical doctor, an engineer, or a lawyer. Because anything aside these three, you basically waste your time in university. And I didn't go to art, so law was out of it, and then medicine. One thing I'm grateful for was, in as much as I chose the medical route, I never lost that creative part of me.
You know, I was laughing was because I didn't like math. I've always not liked math.
I hated math.
Even from primary school, but somehow I did it and I passed.
Hated math.
So it's an error that I studied engineering. So I did engineering, we did further maths, we did calculus, we did strength of material, structural mechanics, and they were all calculation courses.
I hated it.
And I
statistics, hated it. If you show me numbers, you're going to be my
God. Can I just get out of this school?
Goodness gracious. I think there was one time I cried in an exam hall because it was a statistics exam. That 201? Oh, yeah. If I remember correctly. And the frequency and my variables were not adding up. I tried it like 4 different times and time was going. I literally cried in the exam because at some point the numbers were just making a fun of me.
When you're having maybe like 40 as your answer, and then you're not sitting with some intelligent person, and say, what? You say minus 25. All these things are so dry now. So, do you still work in like hospitals actively right now?
I have private patients, but I don't actively work in hospitals. I think at this point, we need to really accept that there are different arms of medicine. And public health is a thing. Behavioral change communication is also a thing. So when I tell people, doctor, I'm a doctor, and they say, where's your hospital? It also means that we still have a lot of work to do because we think, I must wear a stethoscope for me. So, no.
Now, would you say that life situations made you embrace entrepreneurship, or would you say like you're a born entrepreneur? The average Nigerians are an entrepreneur actually because of how life has dealt them.
Would I say I was a born entrepreneur? I don't know how to answer that question directly, but I'll tell you a couple of things about myself and you can decide if maybe I'm born or it was conditioned that made me that. I hate routine. I get bored easily with routine. I knew that going the clinical routes, let me not say medical, going the clinical routes, staying in the hospital and, seeing patients day in, day out was going to bore me out and I was going to be miserable. And I had done that for a number of years, but it wasn't something I was enjoying. I love creating things from the scratch. I love thinking outside the box. One of the reasons I didn't enjoy medical practice that much was simply because you can only think within a couple of predetermined outcomes.
Yeah.
You can think outside the box. The reason you can't do that is simply because there's a human life at stake. The guidelines given to you have been tested and proven, so just follow them. So it was more about the ability to remember and recall information. What I do right now is using old information to create new things. So I'm creating something new from what does not exist, right? And I enjoy it a lot more. So, born entrepreneur. Most people, when they say born entrepreneurs, automatically think of someone who started selling lemonades when they were young. That wasn't me. Of course, I helped my mom.
Yeah, but you actually did sell.
I actually helped my mom sell. I was involved in the exchange of money, buying and selling. I got to know the value of money early. Maybe that helped me thinking about money, but the knowledge about money I got at a very young age was flawed. Right, and born entrepreneur. Let's just say I've always wanted to create something new. Maybe that's entrepreneurship, but
It's probably a mix of both. What do you guys think in the audience? You guys should let us know. So, what was the first business or like hustle you ever did?
Oh yeah, it was in university. Funny enough, a friend walked up to me and said that their designer had disappointed them, and they needed someone who could design. And they wanted to design a magazine. And I told him I could design a magazine. I had no idea about graphic designing or anything. I just knew if I put my mind to it, I was going to create something. When there's something in your head and you know that you could create it. And he said he trusted me, and I was like, oh, go ahead. And I binged hours of YouTube trying to learn graphic designing with my friend's laptop. And I did that gig, and it was successful. It was one of the best designs. I wish I still had that design. One of the best designs that I've ever made. Did I go into graphic designing? No. I did it for like 2 years, got bored, tried something else. After then, I did another hustle in university in housemanship. I worked in a hospital where we were not paid salaries for a very long time, and of course we needed to survive. So it was either working in a hospital
owing you or
the government owing me
for 2 years.
Yeah, for 16 months. I worked for 16 months. I didn't get a salary. Yeah. So you had to survive one way or the other. And for a lot of us, it was extra shifts until I went to Aba with a friend of mine, and I saw this oil perfume I loved, and I bought it. And it was when I got to school, and it was, oh, guys, it smells so good. I realized, I can go back to Aba.
This perfume thing has been like back in the day. It's just amplified now.
Yeah, it's just amplified now. And I realized, I could go back to Aba and still get it at a cheaper rate and come here and sell it at my rates, right? And that's how I got into the perfume selling business.
Isn't that enough?
No, I gave the business to someone else. The entire business.
You just sell it off, or you just
handed it off as a gift.
There's better to do it right now.
Yeah.
Interesting. So this health education you do right now, where did the idea come from?
It came from a couple of other sources. I've always been one that loves educating my patients. The problem with educating your patients is that you spend so much time educating one patient that you literally have no time for any other patients. So I would sit down for minutes and educate one patient for them to really understand, but it was eating into the time. I had to share with other patients. And also because I had seen the consequences of ignorance. There was a man who came into the hospital when I was a student from a transient stroke. We encouraged him, treated him, came back 2 years later, and the same man had another stroke that he died from. And I realized that a lot of people were unaware about their health, even though they came to hospitals. They did not understand, they did not know. And that's where the passion for educating Nigerians came up. Of course, did I start doing it this way? No. I started with the normal way doctors talk. But nobody was paying attention.
Like, hello, this is Dr. Chinonso Egemba.
Hi, my name is Dr. Chinonso Egemba, and I want to educate you about your blood pressure. And nobody was paying attention. And I realized I needed to find new ways to get their attention, and we delved into storytelling.
Oh, that's why you do your things, the way you do your own Nigerian years and all of that.
Yes.
Cool.
Africanese, actually.
Oh, that's true.
There's a lot of other Africans who vibe with it and actually claim that it's been helpful for them.
What's the feedback like from other African nations?
The last time I was in Kenya, beautiful. Tanzania, beautiful. Senegal, maybe because we're a French-speaking country. And I didn't really go out that much. Ghana, beautiful.
Do you think you're going to dub your videos, thinking about like French countries?
Yes. Part of what we're trying to work on is translation into other languages, so that it's better understood by them also.
That makes sense. Now, how old were you when you made your first million?
I honestly can't remember. I know it was during house job. So when you say make, if you count all the salaries they're owing me, they paid it at once. You know, oh no, they paid 12 months of it at once. So I think that's me saying I made my first million. But they basically took my salary and held it for a while before they gave it to me. So it's a bit confusing as to when I made my first million.
Great. So when you were starting out, were there like people that were telling you, "Guy, this is what you do, no go work"?
Oh yeah.
How did you overcome that?
If you're expecting me to say, you know, I sat down and said I was going to move beyond the hatred, that's a lie.
I'll show you guys.
Yeah. It was difficult because many of them came from people I actually looked up to and respected. And it didn't necessarily even come from the "it's not going to work" angle. It came from the "what are you doing?" I mean, you went to medical school to do this.
This is what you're going to do with your life.
This is what you're going to do with your life, right? And it was quite painful because at that point, it seemed like I wanted their validation. But for lack of words, there was just something in me that could not shake off the feeling that this thing I was doing was helping the life of someone out there. And then feedback started rolling in. I mean, people way back in Onitsha could say that they helped someone who was having a convulsion because they had come through one of my threads. Yes. Another mother whose child was choking on an earring. Remember the thread I made and, use that to save the life of a child. And I knew this is beyond me. This is beyond the person giving this feedback. And when I understood that the person giving the feedback gave the feedback from their point of understanding, it made it easy for me to ignore it and just keep trudging.
Makes sense. I said I was going to ask you this question. I believe I asked for everybody when I asked this particular question. Please, who is Emeka Anakechi?
The story I tell people is that Emeka stole my babe whose name was Nkechi and decided to do whatever.
So that's why you're after their lives.
Yes.
Interesting. How do you handle fame? Now, you went from being Dr. Chinoso to Aproko Doctor with over, I checked very recently, you have across board around over 6.4 million followers. There's over 6.4 million people who know and interact with your content. That means that everywhere you go from time to time, I'm not even where you are yet, but I was at ShopRite the other day and somebody was running after me. He said, "Don't, please can I take a picture?" Bro, how do you handle that?
I think the most important thing is not to let it get to your head. Realizing that you're still human. But for me, what's most important is that I understand that trying to hold on to fame is like trying to hold on to ice. Yeah. If you hold on too tightly, it's going to melt. If you hold on too loosely, it might slip off your hands and fall. Whatever you do, fame is fickle. It comes and it goes. So I try not to evaluate my life or my person by the kind of fame I have. I don't judge myself by how many people watch my videos. Do they watch the videos? Yes. Am I making an impact in lives? Yes. And that to me is what matters. Fame comes and fame goes.
What does life look like right now of this happening?
Hectic. Life is hectic. There's many times I want to shut my brain off and just say, you know what, I need to rest, but it doesn't happen. Even when I'm on my bed sleeping, my brain is working. There are other projects we're trying to run off, and it's difficult, I must say, but enjoyable.
Good. So looking back, would you rather have this or how your life used to be before?
No, looking back, I would have this 1,000 times over. Simply because this is, I have a sense of fulfillment.
Yeah.
And I think to me that's what matters. It's many people look at it and say, oh, in the talk because he's already making money from it. Nah, not necessarily. Even when I was not making money from it, I was doing this. At the time when I was working 3 jobs in Lagos State, I was doing
You're
this.
working 3
Yes, 3 jobs.
3 hospitals.
3 hospitals.
Crazy.
3 different hospitals.
Crazy.
I was doing this.
Crazy. How long ago was that?
This was between 2018 and 2019.
Crazy. I can't imagine that, because the life of a doctor is hectic. Then combining 3 jobs at the same
I
time.
was living off my backpack.
Crazy. Crazy. What's the brokest you ever been?
I think it was one Christmas. I can't remember exactly, but it was one Christmas where the only thing I had was sopa the entire day. Yeah. I had a choice to buy some other thing that would, make it feel like Christmas and okpa. And I realized that okpa will hold your belly more for a longer period.
It's heavy.
And immediately I ate that, I slept. I woke up in the evening of Christmas. No hunt again the next day. Yeah.
So, aside health education, what other thing does Aproko Doctor do?
Aproko runs an NGO called the 100K Club. Aproko now produces movies. Basically, my life revolves around this. I don't see myself doing anything else.
Do you feel like you're going to invest in other sectors much later?
Oh, yeah. I feel like I'm going to invest in healthcare a lot, especially the business of healthcare. And one of the reasons I want to do that is to make sure that universal healthcare is possible. So every Nigerian doesn't have to go broke in order to achieve healthcare. It's always possible, and that's what we're trying to do. As a matter of fact, even before Aproko Doctor, there was a major idea in my head that I discussed with my late friend Harold. I wanted to create an Uber for doctors. Before Uber became, that was the idea we both shared. It was, you could see a doctor without leaving your home with your phone. This was way back 2013, between 2012 and 2013, although we discussed that idea. So I know I'm still going to do that. I'm going to invest in this. I'm going to make healthcare accessible, because that's basically what I do. Healthcare accessibility to everyone.
That makes sense. So the first time I met you was in 2020. And around that time, you had like 60,000 followers on Instagram. Right now, you have, the last time I checked, around 1.6 million followers. Since then till now, you've been putting out a lot of videos every day. In fact, every day, every morning, there's an Aproko Doctor video going out across different platforms. That's some crazy work ethic. What does that life look like?
I think it's only possible because I have a team now. And everything you see on the Aproko Doctor channels are the result of the hard work of my team. One of the things I've been able to do is to provide leadership enough, get them to believe in what I'm doing, join me, and we make that happen. Is it hectic? Yes. Is it demanding? Yes. Do we enjoy it? Yes.
That's crazy, because I mean, as a creator myself, I know what it means to sit up and film, and so there's an episode that's going to come out. I interviewed this guy. His name is Pri Sokari. He's the founder of Aristocrat Records. For context, Aristocrat Records is the records that discovered Burna Boy. Right. So this particular interview, because we did different locations, it took the whole day. At some point in the interview, I was begging, please, can we cut it now? I'm done. And I still had a webinar presentation that evening after the shoot. So when you do it at this scale, that's a lot of energy. How do you recalibrate, kind of?
I think it creates systems, right? We've created a system where I'm not directly responsible for everything, which is one of the best ways to actually do anything or scale anything. Because I don't want it to end with just Aproko Doctor, right? It has to scale beyond me. Yeah. That's the only way I can view whatever we're doing as successful. So in doing that, we created a system where different people on the team are responsible for different things. It will come to a time where I'll probably not be on the screens any longer, but we'll mentor the next level of people to become Aproko Doctors. That's basically what we do. Makes sense. So I'm like the prototype Aproko Doctor. We're creating a lot more Aproko Doctors.
Makes sense. So there are more questions I have to ask you, but we're running short of time. But I have to ask you this last question. That's because somebody from the community dropped a message this morning, and like, you're going to interview Aproko Doctor. Please ask him this question. So I'm going to ask you. Said, it's not even an entrepreneurship related question, but in fact, let me read it out to you there because it was so funny. So this person said, I should ask you, number one, what are the safest foods we can be taking, and how much quantity is okay? That's one. The second question is, what is your advice on blood group and genotypes as regards marriage?
Whoever is asking that question has watched the video already, so they should go and rewatch it again. Like I said, your options for genotype and blood group and marriages. Just make sure you're compatible. If you're not compatible, make sure you have the money, or make sure you're not in Nigeria, because there are other options, right? Number two, what fruits are the safest? I don't think there's any fruits that is unsafe. What matters is, like everything, moderation. Yeah. If I give you 1,000 melons, you probably feel sick after them.
True.
So it's moderation. True. Fruits are safe. Fruits are safe. So, yeah. I know what you're trying to do. You're trying to get stuff out of my mouth, but no, it's not happening.
All right. I think we'll draw the curtain here. Thank you very much for accepting to come on the show. And
hopefully we do this again.
We definitely have to do it again.
Maybe this time. Maybe 2028.
Please. please. My regards to Chepamaka.
Oh, my friend. Sure here. Oh, really?
Oh, just tell Joseph said hi.
I will. Let me tell her now.
All right. Thank you very much, Doc, for coming on the show. Please ask people to subscribe to the channel and watch the podcast.
And remember, if you're watching this video, don't forget to subscribe to this channel. Joseph Don is giving a lot of value, a lot of advice, and is going out of his way to ensure that value comes to you.
Out of my way.
The least you can do is just subscribe, like, share, comment. What does that do?
Everything.
It just helps. It helps the channel.
Everything.
It helps the channel. Just click. Thank you.
All right, guys. I'll see you next episode. Take care of yourself and cheers.